This recording will go over the medications imipenem, cilastatin, as well as vancomycin. So imipenem, cilastatin is is in the classification of carbapenems. Imipenem is a beta-lactam antibiotic, just like penicillin, just like the cephalosporins, that works by destroying bacterial cell walls, causing destruction of the microorganism. It is broad spectrum, and it is effective for serious infections such as pneumonia, peritonitis, and UTIs, or urinary tract infections. Complications include allergy, hypersensitivity, and possible cross-sensitivity to penicillin or cephalosporins. So we want to monitor for any indications of allergic reactions such as dyspnea, rashes, and pruritus. We want to question clients carefully about their history of allergy to penicillins and other cephalosporins and notify the provider if present. So you want to group those three medications together. Penicillin, so anything ending in cillin, the cephalosporins beginning with the CEF and CEPH, and imipenem, because if you're allergic to one, let's say you're allergic to amoxicillin, you'd also want to question a prescription to any other penicillin, as well as the cephalosporins, as well as a prescription for imipenem. Other complications include GI upset, nausea, vomiting, and diarrhea. We want to watch for those manifestations and notify the provider if they occur, as well as monitor I's and O's. Also looking for superinfections. We want to monitor for indications of colitis, such as diarrhea. Other superinfections include oral thrush, which is a yeast infection in the mouth, as well as vaginal yeast infections. We want to use the medication cautiously in patients who have renal impairment, so we want to be monitoring that kidney function. Imipenem can reduce blood levels of valproic acid, and breakthrough seizures can occur. So if you remember, the normal serum level, therapeutic serum range for a patient with seizure who's taking valproic acid is 50 to 100. So if the patient's taking valproic acid and imipenem, that serum level may drop below 50, and the patient may experience seizures. We want to avoid using the medications together, but if they are used concurrently, we want to monitor for increased seizure activity. Also, we, like all these other antibiotics, advise the client to complete the entire course of the antibiotic. There's one glycopeptide antibiotic you need to be familiar with, and that is vancomycin. It is commonly used in hospital settings. Vancomycin works by inhibiting bacterial cell wall synthesis. Vanco is the treatment of choice for MRSA infections, as well as pseudomembranous colitis due to C. diff. So it's important with the other ones. I said I'm not worried about you recognizing the different types of infections that it treats. For vancomycin, I want you to know that it is the treatment of choice for MRSA infections, as well as pseudomembranous colitis due to C. diff. It may cause nephrotoxicity and ototoxicity. Nephro meaning kidneys, right? Nephrotoxicity. Ototoxicity, what are we talking about there? We're talking about the ears, we're talking about hearing. So monitor for hearing loss, and we also want to monitor the vancomycin levels. An infusion reaction known as red man syndrome, which is related to a rapid infusion, can cause rashes, itching, flushing, tachycardia, and hypotension. In order to avoid this, we want to administer vancomycin slowly over 60 minutes to prevent an infusion reaction. Vancomycin can be very irritating and can cause thrombophlebitis, so we want to rotate injection sites as well as monitor infusion sites for redness, swelling, and inflammation. Again, infuse over at least 60 minutes per dose to prevent infusion reaction. Renal toxicity can occur, so we want to monitor the patient's I's and O's, as well as kidney function tests and lab values. We want to monitor vancomycin trough levels. So quiz, is the trough the high concentration in the body or low? Hopefully you're saying it's the low concentration. Remember, peak is my high level, trough is my low. Vancomycin, the normal range for trough is 10 to 20 micrograms per milliliter. So we're going to be monitoring those kidney labs as well as INOs and monitoring troughs to help to protect the kidneys and to help to detect if the kidneys start to function poorly. So an allergy to vancomycin is a contraindication. You get ready, vancomycin's been ordered, you're doing your 3 med checks with the patient. They say, I've had an allergic reaction. That would be considered a contraindication. You wouldn't want to administer. You'd want to contact the provider. Your textbook no longer talks about the corn allergies, so disregard that. We want to use cautiously for older adults and with clients who have renal impairment or hearing loss. There is increased risk for ototoxicity when taken with other meds that cause ototoxicity, such as loop diuretics or aminoglycoside antibiotics. We want to monitor trough levels. Again, the reference range is 10 to 20. You want to know those numbers, right? So if the patient, if you get a trough serum draw done and it's low, we worry about not enough medication being in the patient's system. If it's high, we worry about, the levels being a little too high in the body. And what you'd want to do then is contact the provider, and they may tweak what they're prescribing to try to get that serum level back in that trough level and the peak levels back in normal range. Also want to monitor kidney function. We want to monitor for reduction of manifestations of infection, such as reduction of fever, pain, inflammation, and adventitious breath sounds. Adventitious sounds like a good thing, right? But that would be abnormal breath sounds. And then we want to monitor for the resolution of the infection.